just ran back to the kitchen to eat some sushi. But he is also helping co-host with this presentation that we have for you guys. So the real, who we are, what we do, like I said, we're chiropractors, but we provide integrated healthcare here at Clos Chiropractic. We involve other modalities, and one of them, the big one that we're talking about today, is shockwave therapy, specifically radial shockwave. And we'll go through a couple of the other ones that we offer here as well. All right. Again, real nice and easy about what radial shockwave is. So that's what the machine looks like. It's this fun guy right up here. So what we use it for is for soft tissue injuries, or typically more tendon issues, tendonitis. If you have an acute issue in the low back, sometimes it can help with alleviating some of that pain and inflammation. But what it does is it uses a sound wave to penetrate deeper into the tissue. So with that penetration into the tissue, it's about 3 to 4 centimeters deep. And with that wave, it's helping to reduce inflammation by stimulating blood flow to the area, helping to improve on our functionality and help create a healing process, help to initiate that healing process, I should say. So when it goes through as far as what it might be helpful with, like I said, conditions that are a little bit more, say, chronic, right? 6 to 8 weeks, some people dealing with pain, the things that won't go away, tendonitis in the elbow, you got sometimes carpal tunnel, it can alleviate or help with those things. A lot of people deal with calcific tendonitis, or if you've heard of frozen shoulder, those are other conditions that people deal with when they have that limitation of the range, or they get that pinch or that irritation and try to reach their arm up. Other big ones are plantar fasciitis. So the typical or the classic presentation for plantar fasciitis is you first wake up in the morning, it's painful, your feet go flat on the ground, you get that pain in your heels, sometimes through the ball or through the arch of your foot. Those are great conditions that work really well with shockwave. A lot of people, they handle the pain while they're ignorant, right? You kind of live with it, they're like, oh, it's going to go away in a couple days, right? It'll be fine, or let me just massage it, or let me just take some ibuprofen or Tylenol and maybe that'll help. And nothing seems to work, so you just kind of live with it. The other thing that happens is we start to alter our, we alter our quality of life, right? We stop running, we stop exercising the way we want. We used to go on long walks with our dog. Now we're going quick loop around the block because it hurts too much. You're used to doing hair, doing your own hair, brushing it, doing whatever, reaching up to get stuff off the top shelf, and stuff like that. We started being okay, well, let me just use my other arm to assist me. Started things where we started to limit our movements. That's what we want to reduce happening, right? We want to give you back that quality of life. So, I will say what it won't do. It's not going to be a quick fix. It's not going to be the magic potion that's going to go away immediately. But there is that initial response of the analgesic effect where you feel that relief of pain, and it stimulates blood flow. You're going to notice that you're going to feel a little bit more range. It might not be, again, all at once where you couldn't lift your arm past here, but all of a sudden we're reaching up overhead. But you're going to notice gradual transitions. But we also accompany this treatment with other modalities. So we will still adjust you. We will still go through modalities as far as laser, which is this one. But with other modalities and therapies, we're looking to range of motion, and it's not going to replace strength training or stretching and exercising. Okay. What it says down here is the number of sessions. Again, it's not a quick fix. One time you're done and it's fixed and everything's good to go. It might be 4 to 6 weeks of treatment where you're getting the shockwave therapy, whether it's once or twice a week, depending on the condition. Absolutely. Here's Dr. Warren from his sushi room.
So the practice has evolved over the years. My father started joined the practice 35 years ago, got great off. He was a chiropractor for the Colts. And so sports medicine kind of walked from the start. And then he was with the Orioles for a number of years, about 12 years. And when he was with the team, we got introduced to a couple different techniques around musculoskeletal care. So dry needling we started doing in the office about 10, 11 years ago. And it made a huge difference for myofascial or muscle and joint pain that we see in the office, right? And so that was kind of that first step. And then we said, well, we know the importance of strength training. We know the importance of rehab. And so we expanded where we perform a lot more physical therapy in the office to help support injured areas. So before we were really spine focused, and then we transitioned. We started treating soft tissue injury with dry needling. We stepped up even more with creating this area for people to work out and to build strength around injured areas. And then probably about 2 years ago, we got introduced to Shockwave, which is relatively, you're not going to hear about it a lot. It really started in podiatry with plantar fasciitis, and it's really expanded to treating a lot of different musculoskeletal conditions or joint and muscle pain that we see commonly in the office. So in conjunction with the spine pain that we see, there's a lot of myofascial muscle and joint pain that we also see. And this has been a tech that has really helped support and speed up the recovery process. And Angie's going to tell you a lot more about some of those conditions that we treat.
So like I said, the successful treatment of in addition to the Shockwave treatment, we still do the chiropractic adjustments like I mentioned, and then the other modalities that we talked about. We still have E-stim, which is electrical stimulation. Definitely helps the muscles feel good, can be a little bit more palliative to help you just feel nice after the treatments, and just continuing with the strength side of it. Like you said, one of the big slogans of the practice is feel better faster and get stronger smarter. So those are the processes that we follow with everyone's treatment plan, specific to the areas that we're working on. Area. So the conditions that can be treated with radial shockwave, specifically, like I mentioned, the plantar fasciitis is a big one that it's really helpful with. Tennis elbow is another one. Again, the tendinopathies where we get irritations of overuse. If you're someone who works in construction constantly using a wrench or twisting, plumbing, anything like that, where you're using your hands a lot of motion around your wrists and elbows, you'll get some of that irritation. You're like, man, this really aches. I can't fully extend my elbow. Certain things like that, we can look into and we would examine, see what else is going on, and make sure that it is something that will work for you. Achilles tendonopathy, you get that tightness in the back of your heel, hurts to walk sometimes. Walking up and down steps, you're a little bit more ginger, you're starting to flat foot step down. Calcific tendonitis of the shoulder is what I was talking about, like frozen shoulder, where you notice that limitation. Sometimes it can be gradual, sometimes it's more traumatic, where you felt a pull, you went to go reach up a high shelf or pull something heavy down, and you're like, something moved, and the next thing you know, you're like, I can't put my arm past my shoulder height, like something's going on there. Again, with examination, we look at these areas and sometimes also with trigger points and myofascial pain, that's something else that, like we talked about, with anywhere in the spine, there's a different type of shockwave called focus shockwave, and it just takes more of an electromagnetic type of wave that penetrates even deeper that can help with those areas, but we have to be more specific about which regions we treat with that one. And that can help with areas in the SI joints, soft tissues, and the upper traps, more so with this one.
Yeah, so like she mentioned, 2 types of shockwave, right? The one that you see in front of you, it's called radial. Radial is going to be a little more superficial and spread out. The focus technology is pretty interesting, and it comes from something called lithotripsy. So when people get kidney stones, and they go in and they use an acoustic wave to help break up those stones, so you don't have to penetrate the body, it just sits on top. The acoustic wave goes in and it breaks up the calcification in the kidneys. That's how this technology came about, because they saw that the kidneys were getting healthier. There was a healthier cortex around the kidney itself. And so with focused shockwave therapy, you're able to, depending on what depth we want, we can approximate it to what's called a focal zone, or a point that's 3, 4, 5 inches deep. So if I'm dealing with someone with arthritis in the knee, or arthritis in the hip, it's a nice, helpful way of treating down to the joint. Whereas radial, like she said, it's going to be some of those more what we call superficial, so not as much depth from the skin down to treat those areas from a treatment standpoint. But there's a lot of conditions that fall in that umbrella, and honestly, it kind of came when we brought a seminar into the practice, and my father is the guinea pig for all the things that we have here. He's getting his hip worked on, and I'm like, where did Jeff go?
Yeah.
You hear the clicking going on. He's still back there getting treatment, and then he's got 5 different areas that he wants to get treated with folks. And that really, his experience with it brought it in here. From a treatment standpoint, and the effects that he felt right away. And then we've just had really good success with it in the first year we've been using it. So that's kind of a little bit of a really great summary from Angie. I appreciate you as as well as just a little bit of like the history and how it came about and how we're using it right now. And then I just brought in a friend of mine. I'm honest with you, he's a good friend of mine, and who was someone that was just the biggest fan of chiropractors before I met him. Dr. Steve Martinez is here. He is a emergency room doctor at GBMC, and he can tell you a little bit about his experience. I'll let him speak on it. I asked him to come by tonight just to speak about his experience in the office in general, and just kind of like opening up the door to an office like ours, as well as his experience with Shockwave. So thanks for coming last minute. I appreciate you.
Literally, I'm laying in bed because I have to go into work at 7 in like 45 minutes. I get a call from Warren at 5 p.m. today. He's like, "Yeah, come in." I'm like, yeah, absolutely. Because he's a good friend. Also, as someone who's had therapy here, including Shockwave therapy, I'm actually, I'm a big critic and I'm a big skeptic of anything that's a little bit alternative. That's my nature as an emergency medicine doctor. But after going through, I think I did 2 or 3 months of therapy with adjustments, with physical therapy here, and then once a week or once every other week with the Shockwave therapy, I felt a huge difference. Just my fitness journey in general. So I'm fairly healthy, but I was pretty sedentary for the last few years through school and residency, and I wanted to get back into fitness, get back into running, and I realized I've had a lot of tightness in the hips, tightness in the lower legs, and a lot of lower back pain that limited my ability to kind of do that. And even so Warren was able to physically diagnose that without me actually telling him, because I actually didn't realize that I was suffering with that tightness because I've lived with it for so long. And like you said, it's not a quick one-time treatment and you get better. But I'm waking up, in the morning and I don't feel pain, I don't feel stiffness, and it's amazing. It feels really good. But it's a journey. You definitely put time into it and give it a chance. But it does, from my experience, it definitely relieved a lot of pain and brought a lot of functionality back to my life. Get a lot into it. Yeah. I mean, in general, it actually does feel really good.
Yeah. That is the one thing a lot of people are like, well, does it hurt? And I'm like, it's hard to describe. It's a pressure. It's a good hurt. It might not feel the most comfortable initially in the moment, but the effects you get after are really beneficial. And you're like, you do kind of have that euphoric. You get off the table and you're like, wow, I can move a little bit easier. That doesn't hurt to plant my foot all the way. You're like, shoulder range of motion's a lot better here. But yeah, it's like, it's not going to be a one and done, and it's not going to be an overnight, like, wow. But that gradual, like, oh wow, I got out of bed and I didn't have to think about preparing myself for the pain. I was able to walk to the bathroom and not have to put on slippers or put on shoes because my feet hurt as soon as they touch hardwood floors or tile or something. But it's definitely that journey that you have to go through, and like you said, the steps that we take to get there. We want to make sure we're going about it in the proper way to alleviate that pain and then improve on that functionality, get you moving better so that way you can get back into health and fitness the way you want or living life the way you want to.
And I'll say this too, just to spotlight Steve and the team over at TVMC. I've got the experience, unfortunately, of going over there myself and with my niece, and both times I'm really fortunate that he runs and helps to support that team. And if you're ever, unfortunately, in front of Steve, you're in Boston, they have a great organization over there. And I just appreciate you coming by. So thanks for listening to it.
Yay! Integration of East and West, yes.
Absolutely.
Yeah, I totally. Yeah,
I
it's
do
based on
energy
both.
medicine, so
That's
you are so
definitely like the model that we
right.
follow here. We also have a nurse practitioner on our staff that we work with for those who are trying to get more into like the functional
Make him
health
take
side
you out
of
for at
things.
least 2 beers.
So there's definitely a time and a place for medication, for drugs, for surgery, but we always want to go about a more conservative route, see what your body can do here, and we have great networks throughout all of greater Baltimore and throughout everywhere in Maryland, which is what I've learned from being in this practice. They have a lot of deep connections to wherever you need to go. This one just goes for a little bit more in depth of like a little bit more of a visual of what that shockwave therapy does. So while the contact is exterior to the skin, that kind of ripple effect of it's getting deeper into the tissues, like I said, it promotes blood flow, and it can even promote that newer blood flow of like creating blood vessels in certain areas. It's not going to be like all of a sudden you see new veins. It's not that crazy, but it can definitely help promote more of that blood flow to the areas that you need in your body. A couple other things that like stimulating the collagen production, so like tendons and tissues that are more, I would say stubborn to heal. Think about like you sprain an ankle or you pull a muscle, you're more prone to re-injure that area. This technology can really help with promoting that healthier healing in our bodies.
Yeah, and just kind of speaking of it, like when you experience it, we tell people like 4 to 5 intensity, right? In terms of when you're impacting that area. And you'll see the difference. You'll say if I was working on my bone and I had a problem here, if I'm over here, I'm not going to feel much. As soon as I go over that tissue, let's say there's some scar tissue or there's some irritation there, your body recognizes it. You feel that intensity over directly that spot. And radial, it's a really nice way of doing that to kind of superficially find the area. And then with the other device called Focus, you'll really pinpoint it a little bit more so we can work the tissue that has the scar tissue or the irritation, right? And so what we tell people is like, you get to control the intensity. It doesn't have to be like one size fits all. So where I might say that with the pressure of the bars is the amount of intensity, say it was a 5 bar instead of the 10 is the max. For Angie, she's tougher than me, obviously. And so she might be a 7 bar for her to have that 4 or 5 out of 10 intensity. For her to feel, that's a good hurt. My good hurt might be a 5, hers is 7. It doesn't matter where you're at, as long as you're kind of working that tissue and getting that feeling, that therapy at that level. Because there's energy being delivered regardless, depending on the person. So if you're worried about like, oh man, that sounds too intense, well, you get to control the intensity. You get to kind of make it work for you. And what you'll find in the beginning is that you'll be, say, a 4 out of 10 for the bar, the pressure. By session 3 or 4, you might go up a little bit. You might be a 5 or 6. You can handle more because that tissue is responding to the work that you're doing. Think of it in like the gym. You do bicep curls, you're doing 10 pounds, you get a little used to it, your body readapts, adjusts, you get stronger because of that stress that you put through your body when you work out. And the same thing happens from the immune system or from the therapy system in your body. When you work out to this, you adapt to it and you need a little bit more. And we are able to create a little bit more force with it.
And like you said, there's no right or wrong of like the level that you are able to endure. It's not a no pain, no gain. Like I gotta make it to the 10 bar. That's not how it works. But like having that therapeutic dose is what we're looking for. And so whatever that feels like for you, you're gonna have to and what feels okay. I believe it's the same kind of for Focus as well, right?
Very
As far
much
as
so.
the intensity goes.
Yeah.
Again, just feels a little bit deeper. I did want to touch on this a little bit. So common questions we get when people come in or they hear about, oh, I picked your office because I saw you had Shockwave and I want to try it. They'll ask like, oh, does my insurance cover this? And it's like, well, that depends. Insurances can be picky depending on what areas they want to treat. For instance, Blue Cross Blue Shield, they only want to cover for Achilles tendonitis, plantar fasciitis, and calcific tendonitis in the shoulder. So those 3 regions are what we can treat and will be covered by that insurance. Other insurances might have different, say, guidelines or protocols they follow.
Medicare is actually probably one of the larger ones. As we're able to use care practitioner, we're really oriented care for people. You can get hip pain from the tunnel to that shoulder pain that Angie was describing. There's quite a few regions with Medicare that you can get focused on because it's FDA cleared to treat those things. It's FDA cleared to treat non-union bone fractures. Think of that, like there's a stress response to the point of a fracture and you put an energy to that tissue so that it heals faster. It takes a lot of research and a lot of evidence to support something for a fracture. And trust me when I say that, because there's not anything else in this entire clinic that is cleared FDA to support fracture healing. besides the rope shockwave. So there's definitely some powerful support behind this, and it shows the fact that insurance so quickly picked up in so many areas to help support it by having some limited coverage, right? And that's new. There's not even, when I talk to other clinics that have these, they are charging patients $300 a session out of pocket for it. And if you just look at the bylaws, thank you to Tanya, who is so wonderful in that regard, that allows us to supports us in what we're doing. You can really find out with each insurance. So there's a couple there, and what we'll do, if you're curious, is when we do have this free consult, if you want to come in and ask more questions, have your insurance verified for it, we'll explain all that to you up in front. We don't want you to be like caught on the end with anything relative to that, okay? And we do that in any case with patients. When you come in, we verify your insurance before you step in the door. We have an understanding what your coverage is, and then we're able to explain to you when we examine you. This is what you have going on. This is your copay, or you have a deductible, so it's going to cost X per visit, right? And we're happy to have that conversation. We'd rather just get focused on treatment every time we come in. We don't like to do that, so we hire people to do that for us, which is front desk and Tanya, and you guys don't like to have that conversation too many times with your provider. You just want them to help you, right? And so that, in a little bit of an umbrella, gives you an idea of like coverage, right? As it relates to that, and honestly, people are happily paying out of pocket for it if it's an area that's not covered because it's supporting them so well, and they're seeing significant changes early on in the process.
And then going forward, as far as the other questions, like typically don't need a referral from a provider. We are able to provide that because we are doctors in that sense of like we can diagnose and we can examine to make sure it is what you need. And as far as like X-ray or MRI, not always necessary. However, when it comes to insurances, sometimes they want you to get that first in order for them to cover it because they want to see like the definitive proof that you have calcific tendonitis that is more of 1.7 centimeters in the shoulder to prove that that's what's going on for us to work on it. But like you said, we are happy. Like what we want to do is just help you guys get better. That is our job. That is our goal. That's our heart in this practice. And so we want to make sure that we are answering any questions and getting things moving forward in the way that needs to happen for that to make sense for you.
That's a question of like, do you need a referral? Even just coming into this office, and we're going to take questions from you guys too after this, is if you're considered primary care referral for MSK, so you don't need a referral with any insurance. Some of the process require that you go and get a referral from your primary care. It's very rare that we see those. Those are HMOs, Tanya? Yep, thank you. But in most cases, we won't.
I'm used to these.
They just say, oh, send over the question, the primary, and go to clinicals, right? Kind of wrap up. We want to do a little demonstration up here as well, and I'll let you leave from that process from a treatment standpoint if you like. What questions you guys have for Angie and I? Did you have your hand up? Yeah, go right ahead.
How do you decide what level to set the machine at, or are there variable levels before you
So,
approach
as far
a
as-
certain application?
Yeah, so as far as the bars when it comes to certain regions of the body, obviously looking at how deep of a level of tissue we're getting. Elbow's a bit more bony. We have soft tissues there, but we usually start at like, what, 1 or 2 bars and then work our way up based on your tolerance. So like I said, there's no right or wrong of like where you stay, but we usually start at a lower level and then see how you tolerate it. Same thing goes for the Focus Shockwave machine. We start out low and then work our way up. Like you picked up, there's also different heads to this machine that are specific for the areas of the tissues that we're working on.
So they're geometrically designed for the
Yes,
skin
yeah,
or the body point?
absolutely. So they have different standoffs or different heads to them for different regions.
So this is a softer head. Say if I was working on someone with TMJ. Say if I was working on somebody in the hand or the finger, I wanted to take a softer approach. Not a lot of tissue there. We use this. Say if I'm trying to get to somebody that has like glute med or piriformis syndrome, where they have a lot of lateral hip pain. This gets a little deeper. It's a little bit more impactful, and because that tissue is a little thicker there, you can handle it. It feels good to have this. This would feel like, soft. It would feel great. Like this gets the rub. And because that they have different firmness and they're made of different materials, materials. It goes deeper or it goes more shallow based off the material. That's for radial. Focus is, it's all about the distance that the cone is. So if it's a deeper structure, there's no standoff. There's nothing there that separates the device from the skin. If it's very superficial, we have the largest standoff because I know that it's going to go, it always goes to the same point, far away from the skin. So you have to know your anatomy, you have to know your cross-directional anatomy, where things are layered. But you also have to just listen to the patient and be like, hey, am I in that area where you're feeling pain? And it's a lot of feedback back and forth with the patient. It's a great question. Radial sessions are usually anywhere from 6 to 8 minutes. It's pretty efficient from a treatment standpoint. There's over 2,000 impulses that are directed into the skin during that time. So it's like, there's a magnet inside that creates that force, and you guys will see that in just a second. So the treatments are really efficient. What's nice about this office that it's not a standalone service like it is in some places is that, say if I'm working on a shoulder, or Angie's working on a shoulder, before that treatment, I'm going to go and loosen up the shoulder a little bit. I'm going to get some range of motion. And then we might be doing a little bit of the radial shockwave on the shoulder itself. And then that person might go over here, which is really therapeutic, and which a lot of the evidence tells us to do is we're going to put you through some stretches, and we're doing some light work in that area to get some blood flow going to it. So if you combine exercise, and this goes across the board for any condition, if you combine exercise and manual therapy, you will get better results. So if you combine physical therapy and hands-on therapy like chiropractic care, you will get way better results. As it relates to the professions, there's a lot of separation for whatever reason. That's beyond my control. But all I know is that's what the evidence says, right? And so it's such a helpful tool. That's why we've got the space to use it for, right? Oh, and I took a spill of mountain biking, so if you're looking like, what is on his arm?
He will be the patient.
Oh yeah, I'll be patient today. So yeah, no.
Any other questions? Do the demo?
Sure, I'm happy to. Yeah, I'm happy to
All
work.
right.
I can lay face down here. We can go through a radial session on my back. Maybe go into that spot where I felt. Maybe a win-win here for myself. And you guys get to see the treatment. I'm going to jump on the table real quick. And you want to get set up. So we have, some of you have been here before. If you're new here, we have 12 rooms where we have massage tables. And so you get to lay down on something comfortable, or you get this done most of the time. And it's separate to the chiropractic room. So we're able to kind of do our treatment over there. And then we bring patients over to different rooms where there's massage tables and you get to lay and relax a little bit. So it's nice. It's kind of a little bit like spa-like sometimes. You know,
Some
like
people are like, oh, I'm going to take a 10-minute nap
Yeah.
here.
Exactly.
Yeah, people put in podcasts or a little Zen music while they're getting some dry healing.
You'll see some of the marks on my body.
He went mountain biking and took a spill over some rocks, trying to figure out which way best to set this up. You want to help me out?
Say
Yeah.
something.
Please. I think I'll bring it around the other side. I didn't want to block too much of the front of him so people could see, but I feel like.
If anyone's
People are-
thirsty for water, we got some water, so you're going to ask.
Anybody need a water? We're about like 5 or 7. Does that work for just?
Dr. Warren, you're now on a short leash.
What's that?
I said you are now on a short leash after this. Till we answer.
Yeah, just so that way we're not.
Is it like a condition-specific question? While she's getting set up, like, is there something you're wondering? Does this treat X? That might be a helpful kind of starting point for you if you're curious.
So I had a goal that they were going to place melanoma, and obviously they want to treat back down to the muscle. And ever since
Yeah.
then,
Let me see if we can have-
I try to run.
Okay.
So
So yes, definitely can help around those areas, especially where you get scar tissue,
Yeah.
fibrotic tissue in the, like from a scar from where they removed it.
Yeah.
Definitely can help with that.
Okay.
It's bread and butter for it. It's like
Yeah.
I've been waiting for something like this relative to scar tissue.
Yeah.
Because we use Graston and we use tool assisted to go in and scrape fascia and work on stuff.
Yeah.
And that's helpful, but it really doesn't have as much of an impact on your, and Angie's dead on with it. When they look at the studies, they look at it under a microscope to see.
Think about like you get a hole in your pants or something and you stitch it up. There's a clean way you can make it happen where it moves and everything like normal, but there's other ways where people will stitch it and it's all bundled up. You see all these weird strings hanging. You're like, what did they do to fix this hole? Stuff like that. Like that's what scar tissue kind of looks like. What this does is it helps kind of get deeper into it and break it down, but help it smooth out. So that way you have more normal motion through that tissue. You don't get locked up or like there's something
And
around your
once you
shoulder.
break it down, does it stay that way, or is this something that you have to go continue doing?
With physical therapy and with like the exercises and stretching that we incorporate, the goal is no, that you don't have to keep coming back to this. But when it comes to like I said, it takes some time. It will be like frozen shoulder, getting everything to loosen up through that capsule. You're gonna get some range of motion. It can come back if you all of a sudden decide I'm not gonna do anything with my arm. I'm just gonna have it by my side. I'm not gonna lift it. That will come back because it's one of those like if you don't use it, you lose it kind of things. Okay. Same question.
What about arthritis?
Arthritis? Yeah, it can help with arthritis because of the inflammatory nature of it being around the joints and how the shockwave works around it. Again, whether it's the focus shockwave or the radial shockwave, it just depends on the region and the tissue and how superficial or deep it is. Knees, I would say, is a bit more superficial, something like that, versus like your lower back might be a little bit easier to do with the focus shockwave to get deeper into those tissues, deeper into the side joints and help out with that.
Thank you.
How about somebody with a prosthesis? You know, after that's done, you have soft tissue around that area.
You can still work around it. Yep, you can still do it with the prosthetic. We've had people with hip replacements do it. We've worked around the tissue and the muscles. Same thing with if you had like the spine fusion. You're going to have scar tissue around those areas that now aren't getting the same movement that you used to. I saw you had
The bulging disc, the lower back.
It can definitely help with that. As far as radial or focus, I wouldn't say it's going to reduce the disc.
Yeah, traction.
I was like, what's the best way to phrase that one? Yeah.
Yeah, traction over a long period of time, because there's not a lot of things that reduce disc herniations. And traction, when they look at studies for herniations, it takes like a year. Okay, so there's not a lot of things that do that, relatively speaking. But surprisingly enough, most people have this well, they just don't know that it happens. So oftentimes the pain generated in the spine is not always the disc, it's the joints and the tissues around the joint. And so that's well studied. You can look into that. So if there was 100 people I took off the street that were, let's just say, 60 years old, similar backgrounds, experiences, half of those people might have a disc bulge, but you couldn't tell which half would have back pain. Okay? And so that's really an important thing to understand as it relates to imaging and improper treatment in the body. So when we look at somebody from an imaging standpoint, we don't base our treatment off that image. We base our treatment off how well they move, their pain, and what they're capable of doing, and their imaging. And as it relates to, that's probably surprised me the most. Scar tissue, arthritis, those make sense to me. But when I get results with someone with a disc bulge, I'm like, that's amazing. And it's because probably the pain generator isn't just the disc, because they're getting relief in other areas of their back.
Yeah, the traction didn't work. That wasn't working for that.
Yeah, and you know what? You tried it, you know that now.
Tried it.
Yeah, and you don't need to do it anymore. You can say to your provider, hey, that wasn't helpful. And look, it's like that. In general in medicine, it's a trial of care. It's working through different ways and doing the best for the person in front of you. Yeah, we're not 100% in our batting average, but we try really hard to create an environment where we can use other things to make it happen.
Alright, so, like he said, he took his spill. He's having some pain around his shoulder and around the side of his back. He was noticing some rib pain down in here too. Are you feeling it more up through here?
Yeah, we just got the TV.
Yeah. So, if you see that knot and that lump rolling over, I was like, I don't know if you see my arm shake as I roll over it. That's where we're going to be working. So with radial shockwave, we use ultrasound gel just to glide over the skin a little bit easier. Allows us to use the machine more effectively. And for him, again, because the tissues are a little bit like thicker, he has muscle, we want to get deeper into those areas. We're going to kind of work have this guy up here. So this is where the power is, and that's that ticking sound. So those are the pulses. Now if you can see the screen of it, it shows that it's counting down from 2,000 pulses. And it has like a safety on it that it'll like stop at 1,000 and then work its way back up. So with this machine, we're gliding over those spots. So I'm trying to break down a little bit where he's got that sore spot or that knot. You can give me some feedback on how you're feeling.
I think you know exactly what you need to do.
Sometimes we get like, oh, you guys are enjoying this a little too much, this discomfort. And I'm like, it's not always pain, but you want to sit on the pain a little bit. Like, you want to work on it, get it to break down. You'll notice I'm kind of hitting different angles around it. And with this machine, you do have to apply a little bit of force. So we're getting like firm pressure. It's not just like lightly, gently pressing on or gliding over it. We're working through those muscles here. Say that again?
Feel like that?
Yeah, it feels like, how would you describe it, Warren, right now?
It's a great question. So if anyone's seen like massage gun, massage guns feel very superficial. So you feel the impact on the skin itself. When she goes over certain areas on my back, like that right there, I feel it deep to the skin because the force is literally going to the spot deeper than the surface of my skin. So it feels like someone's hitting a massage gun but going 2-3 layers deeper than they normally would be able to hit. And that's in nature, that's part of what's happening. Relative to probably. The really great thing about radial shockwave that's also very therapeutic, when she talks about changing angles, is that we can take somebody, because we have a technique with soft tissue work called myofascial release. I know where the orientation of this muscle and what this problem is, and in order for me to shorten the muscle, I'll shorten it like this, and then I'm going to lengthen my arm and my scap. The muscle is literally going to get a little longer, and when she puts force over that spot, it's going to get even deeper and hit a little bit more of a stretch on the muscle. So you'll feel more like a release on the spot. And we can do that. I mean, I love doing it in the shoulder, because a lot of people come in with pain like between their neck and their shoulder blades, kind of up where she's going up here, and I can move people's head and have them pin and stretch the muscle while she's doing it. So what I was going to show you is when she was on the spot, I was going to reach up and lengthen that spot in different ways. And it really makes it more impactful if you know your anatomy and you're able to apply it in that sense.
Yeah. And so we do that, like, when we're in the room with the patient, we always go, I'll get with you one sec. When we're in the room with them, we are feeling these areas first. And then we're telling them, like, all right, this is what we're going to do. This is where I want you to be on their back. You're going to see it because it's already a little red because I've been poking at it. But we're going to work that area, and then we're going to have them go through that range of motion. What was your question?
Rotator cuff surgery.
Yeah.
Okay,
Yes, it does. I've had shoulder surgery from playing volleyball in college, and it helped a ton with having a rotator cuff injury. For sure. Definitely can. Same thing of like dealing with the tendonitis, even if it's a partial tear or something that's going on in that rotator cuff. The rotator cuff muscles should be supportive and stabilizing muscles for you. What happens a lot of the time is they end up getting overused, and that's where they get injured. So yes, radial shockwave or focus shockwave helps a lot with those tissues as well.
Yeah, I think I worked on like 3 people tears on their shoulder. I actually just sent somebody out for an MRI. She got referred over by her primary care for frozen shoulder. I examined her. I had to say this very lightly. It didn't look like frozen shoulder to me. She'd already been to PT for 8 weeks with no results.
Wow.
And she came in to see me, and I sent, no one had imaged her, first off, which was surprising to me, given the nature and how much pain she was in. So we sent her out for an MRI. She comes back in, has a little bit of thickening. That's mild thickening in the shoulder, but she had a partial full thickness tear of her rotator cuff. And we've been doing focus shockwave on her, and she's feeling awesome. And it's really helping with the pain. And what it'll do over time, the people that taught us how to really use this, who know this back like the back of their hands, it helps people with range of motion pain very quickly. But it changes tissue over time. So you're gonna feel the best you'll ever feel 2 to 3 months after a good session of treatment if you continue to create that good strength around that area. Because that's that turnover, that's that healthy change in the cells locally to the problem itself. And so yeah, it's just been awesome for those type of more advanced things that, like, I don't want surgery on my knee. No one wants surgery on the knee. So taking it to that next level and being able to provide people good quality relief for those type of things, especially if you're short. You're out for like 12 weeks, you're in a sling. And most times, if you get really good quality treatment, you don't, I should say this, in most cases, if you get the right treatment and apply it, you know whether you need surgery, okay? Because you don't respond.
So you're saying that this accelerates the healing of soft tissue?
It accelerates the healing of tissue in general, depending on the depth of what you're on. So whether it's on your plantar fascia on the bottom of your foot, or whether it's in the joint line of a knee that is arthritic, it promotes regenerative healing and promotes stem cell activity locally. That's where it gets its like big name. This is the first conservative management treatment that we've had in here that stimulates proliferation of mast cell activity and stem cells in the area.
So it's clinically proven that it enhances
Stem cell activity. Yeah, that's really, I think, what's pushed it so well. Clinical results are going to do that too, but when they study it underneath the microscope, that's what you'll see is there's that proliferation of stem cells locally. That energy is stimulating the cells to turn over in a positive way. And where you get tendinopathies or tendonitis or arthritis, this tissue is in the state of being in stasis. It's inactive. It's not healthy. It doesn't have good blood. We want to stimulate the blood flow to that area. And this allows us to do it for deeper structures.
Can it help our hands at all?
Trigger finger, de Quervain syndrome. So
Or
people have
joints.
trigger fingers, or it's
On joints?
yeah. You honestly, it's pretty amazing. Arthritis in the hands, yes. Tendon, where people can't unstick their finger, which is called de Quervain syndrome. Dupuytren's. It is really clinically helpful for that. And then it's Medicare allows us to treat people with carpal tunnel, right? And so carpal tunnel is when you have fascia over this tunnel here, your median nerve gets pressed on, and you start to get weakness in your hands or numbness and tingling. That happens in the body in a lot of different areas, right? This is one that can happen. And this is one area that when you work that fascia, it's helpful for those conditions too. Good job. Thank you, Angie.
Angie?
Yeah, one more question.
If you have multiple areas, how do you decide which area is first?
My father has the same problem too.
That's why you're in here. That's why he ends up in here for like 45 minutes after the office is closed. He's working on his hip, his knee, and his back. But I would say, I'm going to give my opinion, when I work with patients and they have multiple areas, I'm going for your top tier one first. After I examine you, if I notice like, okay, well, the one in your knee might actually be coming from your hip. And your hip's like, say a 6 out of 10 pain, your knee's probably maybe 5 or 4 that's bothering you. I would want to focus on the thing that's more intense, that honestly might be limiting your movement more, or limiting your quality of life. I want to work on that area first, and then work our way up. Like I said, with the Shockwave treatment, we're doing that once to twice a week. So if it came to a point of like, really want to work on the knee too, maybe we'll work on the hip on your first day of the week that you're here, the knee on the second day of the week you're here, but we're going to alternate those treatments as you come in.
And Worm's deciding he's not going to be the guinea pig anymore.
He's like,
I'm
got it.
grateful. I'm like,
Yeah.
Angie's awesome. I'll just speak to her. If you haven't met her yet, she's wonderful. And in the clinic, I just like listen to her talk to people. It's like she's been here forever. And so I'm really happy for her because she treats me well from an adjustment standpoint. She's a good adjuster to doing things like this as well. So thank you for taking the time tonight, Angie. I appreciate it. And yeah, if you guys have any questions, you just want to come to us afterwards, you're more than welcome to. Carla, do you have anything that you want to wrap up with? You good over there?
I am good over here.
Okay. Tanya is over here. She's got consult cards. If you want to come in, you want to speak to us in person, she can help get you scheduled as well. And then I think Ken's going to be able to help with that too. But in the meantime, while you're doing that or you're waiting to do that. If you want to come up and ask me any questions about the office, how we work things, or a problem that you got, Angie and I are here to okay? Totally, yeah. I figured like, you know, if you like to sit and watch the demos, or if you'd like to come up and experience a little bit, I think we've got time for a few. I heard you.
You're like, yes, so I was like, all right. I was like, I can't do everybody tonight, but if a couple people are interested, we should definitely do that.
Totally, yeah, 100%. Yeah, it's here for you guys to see it. As long as you give us that consent to care for you.
Yeah. So if you're any liability, you can't mess it up any worse than it already is.
Everyone heard that, okay?
So like everyone else wrote it down, it is 6:46, and you said that, okay. I'm gonna get you.
Yes, it was.
Yes, I have, plantar fasciitis, a series of cortisone shots that made it worse. And they went through, what do you call it, occupational therapy,
Yeah,
and
that's tough.
nothing. So I wear braces. And they don't, it doesn't hurt when I walk, it just feels like I'm walking on a cotton ball.
They don't.
Or a sponge ball,
Okay,
but all my shoes.
is it only in that left foot that you feel it?
No, it's actually in both.
Go.
But I only got the cortisone shot in the left, and you will see the damage that they did by the cortisone shot.
Right.
You can actually see the needle.
How recent did you get that?
Oh, that was years ago,
Oh, okay,
like
but
6
it
years
still
ago.
shows like how badly.
Oh, yeah, you'll see it, be like,
Yeah, like that's real.
yeah.
Okay, so let me have you, you're gonna take off your socks and shoes for me? And I'll have you come on up, if you're gonna, yeah, I was gonna say, if you want, grab a couple face creams. Y'all have to deal with more sweaty face.
You see the hole where they put the last cortisone shot? Look at her face. That's
This happened from the cortisone shot.
Well, it was already there,
That was the
but,
spot.
but they said you need 3 more cortisone shots. So this is, before they discovered the cortisone shot, was outflow. And so I never went back to get it.
So it was already like callous, you're like fibrotic where it's like this. Is that tender?
No, you can push it and squeeze it, it doesn't hurt, but I can't walk barefoot.
Yeah.
And he said it feels more like you're walking on clouds, like a
It, like,
cotton ball.
it doesn't hurt,
That's a classic.
it just feels like I'm walking on like a sponge ball. It's like you can push it,
When I
Yes.
use it to his back, is that
As I said, that's why
I
women
definitely feel like I'm very.
cover their hair because
I mean, you come on.
to attract.
Kendra's gonna help us with the breathing for you, but we're gonna have you up on the bed and like face
So
down.
we're able to obviously, it's close, just because it sits over your like this.
Good
Three of the
question.
muscles rotate out, one of them turn your shoulder. Well, they all work together.
Such as that man has.
But they're tendon. I like this. I like the board. I love this board. It's relative to training. Do that.
I wanna roll up your
Just as weird.
little bit.
Just so we don't get to people with a lot of like neck and upper back pain.
They're working at Water County.
So what you're saying is you want to know there? So you, when you go to lift from up ahead, you might do this.
Guess how you more of them than I'm just gonna pulling on the toe.
So when I watch people raise their arm,
But I also want to
dips to raise their arm.
if I push the foot down, any circumference of that.
No,
Because I push the foot down and then flex the toe and even go.
Okay.
I mean, I feel the stretch, but it's really hard.
Okay.
2 hour movie last night. It was really tough to get up.
For sure.
Okay. He's raised.
You're more than welcome to go
Yeah,
talk
when
to
My
I was
husband
up
here
there,
is-
I felt pressure, but not
Right behind you.
So other things that I could do for you is also adjust your feet. Sometimes there can be like these little bones in our feet that you can that eventually they move. They're supposed to move as we walk, and I can feel how much pressure there is there. It's kind of like pushing back against. So other things I would do is adjust your foot, but again, that would be after full treatment and everything. But let me go ahead and get that ultrasound on your foot. Actually, let's slide this down a little bit for you. There you go.
Feels fine.
Which ratio you have to be on this film? 4 or 5?
Yeah.
4 or 5? I was just saying, it's like, definitely don't want you to feel like you had to flinch away.
Yeah.
You're slowly starting to like, okay, get away from this. Like I said, sometimes we'll pause a little bit, and then we can go up in the bars. This one up a little bit.
Yeah, because they were like, oh, well, we can go in surgically and scrape some of the scar tissue out, but we don't know if it'll help. And if we go too far, you might be paralyzed. And I'm like, I think that's what I'm gonna
Sounds
opt
like
out of.
some that's not exactly the outcome or the prognosis you want to hear for surgery. Yeah, like again, there's definitely